There is another outbreak at Nanaimo Regional General Hospital. NRGH has just gotten through an outbreak of C-Difficile infection, and now the hospital is facing another outbreak of Norovirus, hospital-wide. Norovirus causes acute gastrointestinal sickness, including vomiting and diarrhea. And tonight, some are blaming this latest outbreak on the contracting out of hospital cleaning services. Jonathan Bartlett has more now from our Nanaimo newsroom. Jonathan.
Hudson, this is the second serious outbreak at NRGH in 6 weeks. C. difficile bacterium infected 13 and killed 2 patients in April. If you were visiting a loved one in the Nanaimo hospital today, this is what you were met with at the front door.
Well, I didn't want to go in because my wife has cancer, and I'm afraid that she might catch something.
I have surgery next month, and I'm concerned that something's going to go wrong, and then I have to find someone to watch these guys for even longer, so...
The visitor restriction means visitors are discouraged to come to the hospital unless it's for compassionate reasons. The norovirus outbreak at NRGH has settled a bit, but there are still 10 cases of the virus within these walls.
I know that this is the first time that they actually had a real lockdown like this with restriction of security people and all that kind of stuff.
I think it's gastrointestinal, right? It is. Yeah, lots of fun.
Sarcasm aside, the virus can be very serious to people with underlying health problems. It can cause severe gastrointestinal illness, such as vomiting and diarrhea. The Vancouver Island Health Authority says new cases of norovirus since last week came from the community. This is the second serious outbreak at NRGH in the last 6 weeks. In April, 2 patients died from C. difficile, and at least 13 people were infected.
According to the BC Centre for Disease Control, outbreaks in BC hospitals more than doubled between 2002 and 2007, the same period the government began contracting out cleaning services at hospitals.
The opposition says it's time to bring house cleaning back in-house.
When cleaning services were privatized, clearly the quality of the cleaning has gone down. And this is all the international studies, all the studies of this show that if you give less priority to cleaning, there is an increase, regular increase in hospital infection.
Hillary Jenner is coming to NRGH for x-rays today. She's hoping that's all she gets. Jenner contracted C. difficile at this hospital in 2005.
It took them 18 months to cure me up. I think the cleaners do their best. I think the overworked practical nurses are sloppy with their infection control.
We can blame people till the cows come home, but in fact, if nobody is actually focusing on this as being a major issue, then it's going to continue and it's going to get worse.
You can get infected with the norovirus by eating food or drinking something contaminated with the virus. Shellfish and salad are often culprits. Touching objects contaminated with the norovirus and then touching your mouth, or having direct contact, sharing foods or utensils with someone infected with the norovirus. If you have some of the norovirus symptoms, you should contact your family doctor or call the BC Health Guide nurse at 811.
All right, Jonathan Bartlett reporting. Jonathan, thank you.
You're welcome.